News and information from Georgia State experts about the current global health crisis. This is 88 Affairs, a program for our Georgia State University community and WRAS listeners. I'm your host, Andreas Preuss. Joining us for a conversation about public health during this pandemic is Colin Smith. He's a clinical assistant professor of public health at Georgia State University. Smith is also past president of the Georgia Public Health Association. As a social epidemiologist, Smith's research interests include the burden of disease assessment, population health planning, and geospatial analysis. Colin Smith joins me.
Good to be here.
Thanks for speaking today. I'd like to ask you, first of all, with Georgia being on the forefront of reopening, how has that strategy played out?
Georgia is one of the earlier states to reopen, and there have been a number of individuals who have gone and questioned whether Georgia had potentially opened up early. So far, we have not seen some large spikes in cases or deaths that were potentially anticipated, but we also have not seen continuing levels of decline.
Well, that would certainly be good news, correct?
It's good news as long as we have the capacity to go and meet the caseloads that we have. But remember, there is not a cure for the coronavirus at this point. And the question becomes potentially a moral question. Will we accept a certain number of cases of disease and the burden that puts on individuals and deaths from a disease just to be able to open our economy?
And as a public health official, you do understand weighing economic interests versus health interests.
Certainly. There is a need to look at both issues, but I would push back on the labeling these things as a dichotomy between the health issue of the population and the economic issue of the population. If you have a number of individuals who keep on getting sick and that population keeps on rising and the number of deaths keeps on rising, that has an economic impact as well.
Yes, it certainly does. And really, how reliable is the data on COVID-19 cases?
So the data reporting in Georgia is being done by reports submitted to the local health departments that are then submitted to the state health department who compiles the information. The state of Georgia Department of Public Health has decided that it is only going to publish information after they have confirmed case diagnoses based on the date of first symptoms or signs, not based on the date of the actual test. And this is a political decision that's been made, and it is one of the ways of presenting the information. Some states have done it this way. Some states have done it based on the date of actual confirmed report.
And there was some controversy in the very beginning, well, maybe not the very beginning, about undercounting cases, and that was involving not being able to confirm, I guess, via the autopsy that COVID-19 was responsible.
So I'm not directly familiar with those particular situations. I am familiar with potential undercounts being a result of misclassification. Obviously, early in any outbreak situation, and obviously we're talking about a novel virus at this point, you're going to have deaths or cases of disease that were coronavirus deaths be misattributed. So example, early on, I am sure there were a number of cases of pneumonia or influenza deaths that actually were COVID-related deaths that had been misclassified.
Do you think the Georgia Public Health Department has done a good job in keeping statistics? And they were criticized in the beginning for not doing a gender, ethnicity, just kind of like, here's who's been hospitalized, here's who's dead, here's the cases that are confirmed. When data is presented by a state organization, do they consider all the variations of that data? Because the media will say, we want this, we want that, we want the other thing. How do you determine what data to put out there?
The first thing to realize is that we're dealing with, again, an emerging infection at this point. And this is a public health crisis, and public health by its very nature is always historically understaffed and underfunded. So you may have a health district in Georgia, and remember, Georgia's made up of 159 counties. You may have a health district composed of as many as 20 counties and 1 or 2 district epidemiologists responsible for all epidemiological related events in that broad an area. Obviously, public health was not initially set up to deal with a worldwide global pandemic. So you're talking about requirements changing on a regular basis and people having to adapt to the situation. Yes, obviously the initial reporting that was done was based on individuals' names and their physicians and their phone numbers and maybe their addresses for purposes of contact tracing, not purposes of analysis or even release to the public initially. As various agencies and the public have requested more information, the Department of Public Health has done their best within reason to go and add that information and make it publicly available. Have they made mistakes? Yes, they have made mistakes. But again, we are in the midst of a novel virus, global pandemic at this point. So I think they need to be given a little bit of slack.
And that's a good point, Dr. Smith, that this is a different situation than many have ever faced before or even in their lifetime. And, coming up with those policies are kind of, see what happens, readjust, possibly readjust the readjustment. How flexible are public health groups in that ability to adjust their strategy?
Well, remember, public health by its very nature is a multidisciplinary science. So you have individuals with coming from a variety of perspectives. You have epidemiologists, you have environmentalists, you have policy experts, demographers, communications folks, all working together. So they bring a wide variety of perspectives to the discipline. And because of that, they are able to be fairly agile and go and make changes where necessary.
Is that a very bureaucratic situation?
I would say no. I would say compared to many, many, many other agencies, public health is much less bureaucratic than many others. But at the same time, it is still a government agency. And government agencies, by its very nature, have a certain amount of bureaucracy. But I don't want to use bureaucracy as a dirty word. And I think it's been overused as a dirty word. The bureaucracy are the individuals who keep our government agencies running efficiently regardless of which political party is in control of the government.
I'm speaking with Colin Smith, the past president of the Georgia Public Health Association. He's also a clinical assistant professor of public health at Georgia State. Interesting point again about the moral decisions and the political decisions involving the COVID. Is this a typical play out in a pandemic, or is it just our current environment where morality and political are butting heads or not?
Well, to be fair, we don't have a lot of comparison in terms of dealing with issues of this scale. Yes, we've dealt with other things that have been a pandemic. And remember, pandemic just means it's an epidemic that's happened in more than one country. We dealt with issues like Ebola. We've dealt with issues like Zika. But this is certainly the largest that we've dealt with in over 100 years. So I don't know if there's anything we can actually compare it to. Whether it's typical in terms of politics, I don't know. By their very nature, public health employees leave their individual politics as much as possible at the door. They are the scientific workers trying to come up with the best recommendations for public health action, regardless of the individuals who are in charge of the actual government agencies.
And speaking of public health officials, there was a front page article in Sunday's Atlanta Journal-Constitution, the headline reading, "Experts fear lasting damage to CDC's status." That's the Centers for Disease Control. What was that article about, and what was your participation in that?
So that article was about individuals who are current and former CDC employees who are concerned about the politicalization of the Centers for Disease Control and Prevention. And as everybody knows, CDC is headquartered here in Atlanta, and there are many, many individuals among our local Atlanta community who work for the CDC. The concern has been that politics has potentially interfered with the best application of the science. There was concern, about the autonomy of the ability to do good science outside of a potential political interference or contact. My interaction with this is I helped facilitate the journalist who wrote the article in obtaining information from a couple of current CDC employees on an anonymous basis, working as a go-between between them, guaranteeing the confidentiality of those individuals.
You're a great source to have as somebody that can do that, is be a conduit between the CDC workers and the Atlanta Journal-Constitution writer. And the people that we were speaking to are just via your long connections as the past president of the Georgia Public Health Association and people that you know.
Correct. Again, I've been living and working in the state of Georgia since 1993 and have been involved in one form or another doing public health work for the past 25 years. These are individuals that I have met in a personal and professional context.
Is the CDC, and I hesitate to use the word secretive, because it's certainly not, but is it a kind of cloistered environment there?
I don't know that I could speak to that directly because I've never actually worked for the organization itself.
And then the article's talking about frustrated CDC employees. And then one of the main points, and anybody who's watched any television knows Dr. Anthony Fauci. And where was the CDC director, Robert Redfield, when this was going on, weeks ago, months ago? That was one of the points of the article.
Correct.
These frustrated CDC employees, you said you found two of them that were willing to speak with the journalists via yourself, correct?
Correct.
How did that editorial process work with the AJC?
The journalist pitched the idea to me, and we negotiated the process of how this was going to work. I would go and approach some of these individual contacts through my channels and solicit a number of them. I ended up soliciting 20 of them. 2 of them ended up being willing to participate. And then the reporter provided me with individual questions, which they would then answer. I would screen those to make sure they did not reveal anything that would potentially identify them, and then randomize the responses between them so it wasn't obvious which one had responded in which order to the question. I guaranteed that the reporter would not get the name, race, age, or title of these individuals. The reporter was fine with this. The reporter's initial editor was fine with this, and we then proceeded with the process. The reporter then came back with additional follow-up questions, which I submitted to the individuals, and they answered those questions, and I passed those back along. There was some pushback or potential pushback later on about the potential chain of custody of this information, and I volunteered to the reporter that I'd be willing to sign an affidavit testifying to the fact that these individuals were, in fact, CDC employees, and the AJC decided that that was not necessary.
Well, it's great to see the due diligence to vetting anonymous sources, which is very important for journalists to do, and it looks like you were a great help in that. The CDC, you've had a lot of conflicting reports or directives from the CDC and other governmental public health associations or departments that are saying, wear a mask, don't wear a mask. Clean the surface, don't clean the surface. 6 feet apart, further than 6 feet. Is this a typical kind of confusion that is related to pandemics in general, or really this novel virus that we're dealing with right now?
Well, I would say that this is more a result of the fact that this is a novel virus situation. And remember, the science is only good as the latest information that we have. And the job of public health agencies is to go and make recommendations to keep as many people as healthy as possible based on the best science. And again, in a novel virus situation, the science is continually changing.
Is the public understanding that? Is that something the public needs to be reminded of? Do you think that's something the public gets? or do you just think they get confused?
I think there may be some confusion. There's an entire field within public health referred to as risk communication, which is about going and making sure that individuals receive the proper information on the risk. But the decision of which behaviors to engage in, whether to wear a mask, whether to not wear a mask, whether to engage in social distancing, whether to go to work, to not go to work, etc., is up to the individual. Those decisions have to be made by the individual. They're not the responsibility of the government. So it's the job of public health to make sure that folks have the best, most current information so they can make their own choices.
And the current testing situation. At first, tests were by doctor's orders. There could be a fee involved. Right now, you could be driving down the street and see a free COVID-19 test site, and you pull in your card, it's self-administered. Once again, the state government and local government has kind of readjusted to get as many people tested as possible. And how does that play into the public health?
The whole point of having expanded testing is necessary to be able to do contact tracing. And one of the requirements that both the WHO and the White House made when they talked about the initial plans for reopening economies was to assure that you had efficient and effective and enough volume to be able to do enough testing. Georgia has done a pretty impressive job actually increasing the quantity of the testing that it was done. They've actually exceeded the capacity that I thought they were going to be able to achieve.
Yeah, and you do see them, the news coverage points out testing sites. Like I said, I was just driving down the street the other day, saw one pulled in and did the self-administered test, which, by the way, doesn't hurt. A little unusual, but, it gets in. I got the results in one day. Literally, probably less than 24 hours. And the data, concern about data and where is this going, being anonymous. What are your thoughts on collecting data on individuals that are taking these tests?
So remember, whenever you go and engage in public health activities, you're talking about things being covered under HIPAA, the Health Insurance and Portability and Accountability Act. So the whole point of having those regulations in place is to protect what is referred to as IHI, individually identifiable health information, or PHI information. Public health agencies take the protection of this very, very, very seriously.
Well, it's good to know, but when I drove through the test site, I wasn't given any paper, no receipt. I just showed the lady my license. She wrote down some stuff, asked me my address. I showed her the license, no social security number. And like I said, who, what? I mean, I should have been asking more questions. And by the way, my test did come back negative. It was just an interesting thing to just drive through and have this done. So I think that is something that is surprising, that Georgia has really stepped up to get as many people tested as possible. I'm speaking with Colin Smith. He's a clinical assistant professor of public health at Georgia State University. He's also the past president of the Georgia Public Health Association. I would like to ask, and this is kind of a free-form Q&A here, just our future, and you being a scientist and somebody who's kind of lived in public health for your career, what will be the new normal? I'll bring up a couple of scenarios here. What will the new normal be for office workers?
So I think we're going to have to reevaluate many of our concepts of the open office. In the past 10 to 20 years, there's been a move towards doing away with individual office spaces and have people in large, open, collective spaces, even more open than the traditional cube farm that people were put in the 80s and 90s. And I think we're going to have to talk about how we spread those people out and maybe talk about how we redesign office space to make sure there is more individual partitions between people again.
And this could also be directly related to education. If and when students return to Georgia State University for in-class session, I assume that's a similar concern.
It is. So early guidelines are starting to come out from Georgia State on what will potentially be done in the fall, including maintenance of 6 feet distance, potentially staggered class meeting sizes, and face coverings and things like that. We're still in the process of waiting to see what the actual regulations that are adopted are for that, however.
Yeah, I'm not asking you to predict what that will be, but policies are being developed right now. And then what about public transportation? Anything from the MARTA to an elevator?
I know the recommendation has already come down for elevator use. And elevator use on the Georgia State campus, I believe, has been recommended in the fall for no more than 4 people in an elevator at a time, all while maintaining as much distance as possible and all while maintaining face coverings, to give you an example.
And then what about public transportation on a larger scale, like riding a MARTA train?
That's going to be problematic. I'm not going to deny that. It's a shame because, Atlanta was in the process of, finally expanding much of its public transportation and or alternative forms of transportation options within the past few years, discussing how we would actually go and become a more urban and pedestrian-friendly city, trying to get people out of cars. It seems like that may be stalled a little bit at this point.
And then what about public space, parks, streets? Do you see this being altered?
Right now, the majority of the spread that we see is within confined spaces. There's a lot less spread when individuals are outdoors. That does not mean it doesn't happen. It's a lot less likely. I would hope that people would still want to engage in the wearing of masks and maintaining social distancing even when out in public outside.
So really you do see mask wearing as something that is necessary for the new normal?
I see it as until we know better, let's work under the assumption that each of us is actually potentially infected and trying to prevent any additional spread from those around us.
And really the safest thing would be to either have the antibodies or a vaccine.
On the first part of that, I need to go back and remind everybody that this is a novel virus that we're seeing at this point. We do not yet know whether actually having antibodies for the disease is protective, and if it is protective, for how long. So I would say that we're really going to, because we don't know that, I would recommend that we continue to engage in some form of protective behavior or recommendations for protective behavior until we actually have a vaccine.
Yeah, but the college experience is all about social interaction, going to football games, going to concerts, going to clubs. That's kind of out the window at this point. I mean, you're going to socially distance at a football stadium. It's possible. That may not be what people signed up for, but you just think that there's going to be a post-pandemic generation that's going to be the new normal. Social distancing, mask wearing, getting tested on occasion, that's just going to be the new normal.
I think that, again, we're in a novel pandemic-type situation right now where we just don't know. Our prognostication lens is not particularly good right now, and we're just going to have to take this, a day, a month, or a week at a time.
Well, I love your answers, Dr. Smith. Not yes, not no. We just don't know, but that is the fact with this novel virus, and you really put that in perspective for us. And then you are going to be teaching again, and you teach graduate students and undergraduate students. How is this current situation going to be playing into your lectures or your courses?
As of last semester, we moved everything online. Over the summer, the courses are all being taught online. Come the fall, moving as many classes as possible with appropriate social distancing and coverings back into the classroom. Of the 3 classes that I was planning on teaching in the fall, one of them was already scheduled to be online, and one of them was already scheduled to be a hybrid. So the question is, will the other class be taught in the classroom or not, and whether the hybrid class will have its potential in-class component pieces taught in the classroom. If so, how, and if not, how to potentially teach that online in a different interactive format.
And I'm sure a lot of professors are struggling with those same questions, or even the future, which we're not predicting. But some people take to technology easier than others, and there's a whole new online education experience now that has kind of hopefully not totally replaced in-class session where students get face-to-face with a professor and go over books and things and get that interaction in the classroom, which is very important. That is traditional learning, and I still think that's the best way to learn, but here we are in this online education experience. Do public health officials discuss if somebody's not going to wear a mask? If somebody in the class refuses to wear a mask, how are policies, and I'm just using Georgia State as an example, it could be anything. It could be at a concert where somebody's not wearing a mask. Are public health officials working with, I guess it would be administration, law enforcement, security? How are those kind of situations handled where people just aren't going to wear a mask?
So I don't know about the specifics of how things are being implemented on the Georgia State campus at this point, but in terms of public health agencies in general, there are laws on the books. The one that is regularly cited is Jacobson v. Massachusetts, 1905, that does give public health agencies the authority to go and restrict individuals' civil liberties in the protection of the public's health, if necessary.
Well, that's all fine and good, but what does that mean? Once again, we're not speculating here, it's just a question. Are people signing something, committing to wearing a mask that they know right up front you're not going to be allowed in class? And once again, I'm just using this as a general, not specifically Georgia State, but signing some type of document that says, I will wear a mask, I will practice social distancing. Is that something that institutions will be doing, whether it's a workplace or a school place or even a concert ticket that could have that pressed on the back of it?
I have not seen such activities or recommendations made so far, but it is a possibility.
Yep. And as you've said, this is a novel virus. There's a lot of questions. There's a lot of recalculating. And I guess we'll just have to see how all this plays out. Humans are very resilient, though, and we will get through this. What's your thoughts on just making it through this?
Well, as you stated, humans are a resilient species, and we've been through, global pandemics before. The Spanish flu of 1918 went and changed the way we interacted in many cases. Many of the laws that we have in public health and understanding of how we interact with each other are a result of that. This may end up going and changing some of those social norms, as you alluded to.
Colin Smith, thanks for joining me.
You're very welcome. Thank you.